Hi guys, how is everyone doing? Welcome back to another video. So in today's health talk we will be talking about haematuria, which means blood in the urine. So we will be talking about the common causes of blood in the urine. If this is something you're going to be interested in, kindly keep watching. Yeah, so like I said earlier, haematuria means blood in the urine. So the passage of blood in the urine is called haematuria, and it is a very serious symptom, and it must be fully investigated to exclude cancers. Okay, not everybody presents with blood in the urine, but once a patient presents with blood in the urine, it's very serious. So as a patient, if you find out you're having, dark colored urine, you're having blood in your urine, you should quickly see your doctor as soon as possible, because it always indicates that something serious is going on. Another thing we should take note of is that there are some drugs that causes blood in the urine. An example of a drug that does that is rifampicin. This is like an antibiotic that is used to treat tuberculosis. So in case you're taking those kind of drugs, or like this one I just mentioned, and you're having blood in the urine, it could be as a result of the drug. So maybe it's not something serious, but still you need to see your doctor still, okay? And another thing is, occasionally people mistake menstruation for blood in the urine. When you're having your menstruation, you tend to have blood in your urine sometimes. Yeah, just take notes, just so you know it's not something you need to run to your doctor for if that's the case for you. So when we go to causes, which is like the main reason why I'm making this video, there are lots of causes. There are different areas, different organs in the body that when they are affected can cause blood in the urine, and it's a lot. So I'm just going to touch the common ones. One of the most common one, when it comes to the bladder, it could be bladder infection that can cause blood in the urine. It could be bladder stone, it could be bladder cancer, it could be prostate hyperplasia. So benign, not cancerous, okay? Benign prostate hyperplasia. It could be cystitis, which is like the inflammation of your bladder. It could be bladder stone, it could be bladder infection, okay? Those are the common causes, especially in men. When you hear a man has blood in the urine, most of the 99% of the causes of men with blood in the urine is it has to do with the bladder. So monitor the bladder closely. Another organ that when there's an issue causes blood in the urine is the kidney. The kidney is, once there's a kidney stone, there's a kidney infection, there may be blood in the urine. So once you present with that, your doctor has to also check your kidney and see that everything is going fine. Another common cause of blood in the urine is urethra. So your urethral tract, your urinary tract, when there's a friction, there's an injury, there's an infection in that tract, it can cause blood in the urine. You can have trauma there. The trauma could be as a result of maybe professional negligence, but most of the common cause of urethral trauma is usually the doctor's side. So maybe when you're passing in a catheter and you did not do it right. I don't know if you know what a catheter is. A catheter is like that urinary bag that they pass in through to help you pee in case you're having difficulties peeing, or if you've done a surgery before and you cannot walk around to pee, they just pass in a catheter so your urine can be flowing into the bag. So the process of passing that catheter, if it's done wrongly, it could cause a trauma, and it'll make you bleed. It could also be as a result of infection in the urethral tract. Also, UTI can make you bleed. It's not common, but yeah, it can make you bleed. The signs and symptoms, which are also very important. The associating symptom the patient is presenting with is also very important when you're dealing with someone with hematuria. So the common signs and symptoms we notice are fever. Apart from the blood in the urine, the patient may present with fever. Abdominal pain is almost present most of the time. Like I said earlier in my last video, flank pain. There's also difficulty urinating, or pain during urination, or urine urgency or frequency. So urgency means like every time you just feel like you can't hold it, and when you go to the toilet, it's just something that just drops up, pump, and you'll be like, what? This thing has been doing me as if, you know, it's a lot, and then you go to the toilet and it's just one drop. Yeah, so urine urgency is like a symptom that is also very present when someone presents with hematuria. There will be suprapubic tenderness. In my last video, if you haven't watched my last video, you can watch my last video where I showed you guys your suprapubic region, just below there. Yeah, there's tenderness, there's pain in that region most of the time. There could be abdominal mass. Yeah, another common presentation is pallor. When a patient is pale, it indicates that there's a bleeding going on, reason why you're having blood in your urine. So that's basically the brief knowledge on hematuria and things you should check out for when a patient presents with hematuria or when you are having hematuria. So investigations, so those are like labs and so many other tests that your doctor would have to perform, will have to request for, just to make sure that he or she is getting to the root of your cause of hematuria. So some of the labs and investigations are full blood count, abdominal ultrasound. If there's any mass or if there's any pain somewhere in your abdomen, they're going to request for something like that. Even if there is nothing, just to be on the safe side, they may have to request for something like that. There is urine culture, where they take your urine sample and then, you know, do some whatever on them. There is BUE and creatinine. This is like a test, bilirubin, blah blah blah. This is like a test to just check out your kidneys and see that your kidneys are fine. The abdominal ultrasound will check out your organs in the abdomen and also your bladder. The full blood count to check out for anemia, if you're anemic already, so that they can do something about that. And also if there's any ongoing infection, you know, just these are tests that would help them with your diagnosis and with your treatment. So the treatment objective, which will be the main reason for treating, is to prevent complication, to relieve your symptom, and then to find out the cause and treat accordingly. So we have come to the end of today's video on hematuria. I don't know if I missed any part, but if I missed any part, please pardon me. And yeah, don't forget to like, share and subscribe. You can leave your comments in the comment section and I will reply each and every one of them. I would see you guys in my next video. Bye. So yes guys, I'm back again. So we have this hat for kids, this beautiful hat for kids. This is going to help a lot with the summer and the sun, doing the summer activities. This is the black and white Dalmatian print. We also have another kind of black and white Dalmatian print, which you'll be seeing shortly. So yeah, this is the other type of black and white Dalmatian prints. This is very good for the sun. Okay, get it for your kids. So we have this this head warmer. I call it head warmer, some people call it baby cap, so whichever one you call it. Yeah, this is the yellow color. We have this is the cream color. We also have another color. Let me see here. Yeah, so this is the third color. It comes in several other colors, but these are just the samples that I am showing here. So any color you're interested in, just kindly send a WhatsApp message to the phone number at the end of this video, and we will respond, or just send us an email and we will respond. And then we have other designs like this. Yeah, so this design is, I think, just for girls. I don't think a boy mom will get this for her son. So this is just for girls. It comes in different colors. This is the pink, and then we have a yellow, and then it's very tight. The material is, you know, very solid. It can last you for a very long time. We also have the pink. Yeah, this is the baby pink. Like, it's so beautiful. Also, we have caps, face caps. These face caps are for kids, as I said earlier on, not for adults. It has a smiley emoji at the back, which is very symbolic for kids. Yeah, but it's very beautiful. This is the white. It comes in other colors, as you can see in the video. We have orange there, we have red, we have navy blue, we also have yellow, we have cream. Okay, so yeah, that's cream. We have yellow, so this is yellow. And then we also have black, which is coming right up. Yep, that's the black. And we have pink, baby pink too in it. Yeah, so different colors. I'm 100% sure that we have more other colors. These are just the samples I have here, so that's what I'm showing. But any color you have in mind, I would still be, you know, posting more updates about upcoming colors that are available. But these are the colors we have right now, and you can just place an order by sending a WhatsApp message to the number showing on your screen, and we'll get